Hey everyone, my name is Eddie Joe. I'm an intensivist. The article that I'm going to be taking apart today is called 1-Year Outcomes Following Tracheostomy for Acute Respiratory Failure. It was published on the 8th of August of 2019, in other words, 4 days ago, because today is August 12th, 2019. I'd like to start off by saying that this is my interpretation of the article, and I may be making some errors. I'm not a statistical genius, I'm a boots on the ground bedside doctor, trying to do the best for my patients. If you learn absolutely anything from this article or my discussion, please hit the like button. It really helps the YouTube algorithm promote my page, and therefore these articles are shared with more people. Also, please follow me on Instagram and Twitter. My handle is @EddieJoeMD. Also, the links to this article as well as many others are on my website, eddiejoemd.com, also linked in the description box below. Okay, now that that's all over with, let's get started. This article was recently published in the Critical Care Medicine Journal, which is the Society of Critical Care Medicine's journal. And I really liked this study because it is extremely useful, both for bedside nurses to know, respiratory therapists, primarily for physicians, but most importantly, it is important for the patients' families to know about this article and the data that's going to come out of this. Okay, so I'm going to come over here, and pardon as I go through my screens. Let me go ahead and figure out a way to not take so long in doing this. But the objectives of the article was to describe what it actually entails to get a tracheostomy, because there's significant decisional conflict and regret. So what they wanted to do was to find the 1-year outcomes and healthcare utilization following a tracheostomy. How did they do this study? Well, I thought this study, which is ultimately a retrospective cohort study, obviously you cannot do a placebo-controlled trial, randomized controlled trial on tracheostomy, but the way they did it was particularly cool. It turns out that California has some sort of government computer system which records all the hospital discharges, and these authors did a phenomenal job of going back and accessing via ICD-9 codes or ICD-10 codes people who received a tracheostomy during their hospitalization and what their outcomes were for 1 year after that. Now, this is really cool because this is the data that they were able to get from 3 years ago. In 1 year, we should have even further follow-up data from this. So we will have the data for 2 years from now. So I thought that was phenomenal. And I really tip my hat to the authors for thinking of this study and leveraging the system to be able to get us this data, which is very helpful, and you'll see why. Okay, so let me get out of this one because I'm going to go ahead and start doodling a little bit more. Okay, so the primary outcomes for this study was 1 year mortality. Sorry if you can't read my handwriting. Okay, they also wanted to determine mortality at hospital discharge at 30 days and 90 days after tracheostomy. Now, the secondary outcomes included where the patients were going to end up going, all-cause readmissions, healthcare utilization for the tracheostomy, and then they divided the people into two groups. Okay, they divided into those greater than or equal to 65 years old, and also those patients who were, less than 65 years old, because there's great differences in the analysis that they got from this. All in all, as I go ahead and let me see if this will work. Nope, that didn't work the way I wanted it to. So all in all, they looked at a total of, as I clear this out, they looked at a total of 8,343 patients. Okay, and as I mentioned, the two categories were greater than or equal to 65, or those who were less than 65. Now, all comers outside of these two groups, all comers, the mortality at 30 in hospital was 18.9%, which is pretty high. You get a trach, you still have a 19% chance of dying inside the hospital. At 30 days, it's 22.1. At 6 months, it's 42.8%, and at 1 year, it's 46.5%. What does this mean? Anybody who gets a trach, you have a 46.5% chance of being dead within 1 year. Now, The way I like to think about this is showing how many hospital days the patient is going to have to endure in the hospital trying to get over getting over their acute illness that caused them to get a trach in the first place. And by the way, they use non-surgical patients. So they use neurologic patients as well as medical patients. The quality of life, which cannot be measured by the study, of course, and it's one of the limitations, but it's a very understandable limitation. Would people want a tracheostomy if they knew they had a 46.5% chance of dying within 1 year? I don't know. That depends on the individual. Okay. Now, if you look at the 1 year mortality in patients who are greater than or equal to 65, that was 54.7%. So if you're greater than 65, greater than half the people who get tracheostomies go ahead and die within 1 year. If you're less than 65, that number is a little bit more favorable, but it's not necessarily great. Those people have a 36.5% chance of dying. Now, the median amount of days that these people lived after they get their tracheostomy, if you are greater than or equal to 65, chances are you lived a median amount of 165 days. People who are less than 65 did have a longer life. Their median survival was greater than 1 year. Why can't we get this exact data as to why it was more than 1 year? Well, that's just because of the limitations of the computer system that they use to calculate all these numbers. So as time will go by, these authors should be able to give us an update every single year as to how long these patients live after their tracheostomy. So continuing along with this, I already talked a little bit about the mortality at 1 year for 65-year-olds, which is 54.7. This is abysmal, guys. And for those who are less than 65, it's 36.5%. There are also numbers that we could use to fill in here, here, and here, but I'm not going to go ahead and waste your time in doing that. There is another set of important numbers that we could discuss here for these patients, and it's called how much time they spend before they get readmitted. So I'll put over here readmit. Now, if you are greater than or equal to 65, chances are you're going to be readmitted to the hospital within there is a 47% chance that you're going to be readmitted within 1 month. So you think you're getting out of the hospital, you're all happy, but chances are within 30 days, you're going to be back in the hospital. Also, for those patients who are less than 65, 32% are going to be readmitted within 1 month. That is also a pretty high number. You're not getting out of the hospital for good, guys. Odds are that these patients are going to be coming back. The other big numbers that we need to look at is our costs. And in average, between both groups, those who are less than 65 years old and those greater than 65 years old, the costs that they were able to extrapolate are $215,000 approximately per patient. So if you extrapolate that through national numbers, and I'm going to see if I can get rid of some of these things quickly. It's not going to work out quickly. But all in all, let me see if I can just make this bigger. We spend as a healthcare system $11 billion. Let me see if I could do math on the spot. I guess that's the right number. We spend $11 billion as a country taking care of these patients. And that does not include patients who go to nursing homes, their rehab facilities, their home health centers, their outpatient visits, their post-acute care. Also, it does not include the numbers that the families have to endure when, they have to buy a new car to be able to transport their patients, let's say, for example, with a ventilator, something like that. It doesn't explain any of that. What this article does help explain is it helps us tell the families what life will be like once the tracheostomy is performed. That they won't necessarily be jumping rope and being, back to the way they were before the tracheostomy occurred in the first place. Also important to note that this study showed, as I probably mentioned before, that neurologic patients did better than the medical patients. Now, one thing to keep in mind is that every single case is different. So everybody's going to go ahead and say, oh, but you know, my family member is going to do well because my family member is going to buck the trend because they're special. And yeah, chances are they might be that special person, but statistically speaking, and that's the reason why these studies are important, chances are that's not going to happen. You know, every case is different, of course. Now, they had some limitations to the study, which I don't think they're really big deals when you get down to the nitty-gritty of it. It only took place in California, which means that they can't generalize it to the rest of the United States, or the world for that matter. And this data is only between 2012 and 2013 that they collected this data, and the follow-up was until 2014. So hopefully in 2015 data will be out soon and we'll be able to get that as well. And they were unable to measure quality of life in these patients, which is very important because we do not know what quality of life a patient's family member would be acceptable to live. One thing I like to tell my patients' families is, you know, if their family member was at the head of the bed looking at themselves as they're comatose or critically ill or whatnot and about to get a tracheostomy, would they say, yeah, go ahead and do the tracheostomy, put me on a ventilator, send me to a long-term hospital? Or would they say, you know, let me go and pass on to the next life comfortably with dignity and respect? I don't know. That's all dependent on the patient's family. Nevertheless, I hope you guys enjoyed the quick analysis of this video. Please hit the like button, it helps the channel grow. Subscribe if you haven't, because I have a lot of content coming up and lots of exciting things. And I appreciate you joining me on this ride. Have a great day, guys. Thanks.